Appreciate it. Well, good morning, everybody. How we doing? Well, hopefully you're having a better day than me. Come on now. We're working through a lot of challenges here, but I appreciate everyone's interest in these topics. So I'd like to go over some first before we get to some of the elephant topics in the room with COVID. So let's first hit on the messaging from the Defense Health Agency on the potential reductions in facilities. You all read that in the paper? Show of hands. You might want to? Okay. Really, that's a vote of confidence, right? Because there's 50 facilities that have been selected for reductions. Guess which one is not on that list? That's right. Yours truly, your team here at Madigan. Let's hear it for them. I want to see a round of applause for these people. Because I don't know how many folks manage this every day, but with 5,000 patient visits a day, I'd say these are pretty engaged individuals, and we do owe them a great deal of credit and thanks for their work, because their work was towards the Defense Health Agency's review of the 703 working group. And those work groups take weeks to put together those information in order to support this. And what that means is we are still set currently to deliver the same care we have previously for the past probably couple decades, right? There'll be some adjustments, changes, maybe of additions, maybe even some curtailments of some things, but no removals of any services at this time. Let's go to the next slide. And go. Okay, so we've got some resources also to touch on that are kind of important, right? And I think we're going to talk a little bit about urgent care after this. But the nurse advice line numbers and the patient and the Puget Sound appointing are two key numbers you should have. Please make sure you have these either written down or if you have slides, circle them on your slides to make sure you have those for questions related to some of the issues we're going to talk about with COVID, getting appointments, and then, of course, finding out where urgent care facilities are in the local area. Let's go to the next slide. So urgent care benefit is a very, very rich benefit. They did not have this benefit through pretty much 2/3 of my career, right? Long, long time. And it's an opportunity for family members and retirees to go in. The retirees would pay a copay. The active duty family members do not. They go in there basically as prime. Their copays, though, are now currently none. But I won't say that potentially might change in the future depending on what Congress decides. But still right now, it's another vote of confidence for our system. But it's important to understand how you access these entities. And so when you do, there's a referral management center number on there. You can hit on option 5 for any questions related to urgent care. And again, we talk about the numbers to kind of get down. There's your number right there. Give you about a second. Take a look at that. And next. Okay, this is ear, nose, and throat clinic promotion of review for preventive measures for health, right? The cancer screen drive. And this is one of those areas that as you're kind of looking through your records and looking through, hey, when's the last time I've been to the doc, and any kind of issues or symptomology that might come up, asked about this during your primary care visits and your visits to urgent care. And they can kind of give you, based on your age and other demographics, whether or not you need to be screened or can screen you right there to kind of give you some peace of mind. There are plenty of slots in there, and no referral is needed for this particular service. Next slide. Okay, there's an open house at the Intrepid. How many know about the Intrepid Center? We do have an Intrepid Center. It's one of 7. Not enough of you folks know about it. So good thing. Mr. Sadler, can you hear me? I'm testing his hearing aid. Okay, all right. He was telling me earlier I need to make this a little bit louder for him. He represents our TBI Intrepid Spirit Center back there. They got PT, OT. They deal with oftentimes post-stroke type of issues, brain health, a whole bunch of other holistic medical opportunities. Please see them in the back. If you have any questions, there's going to be some interesting things coming up here on the 19th of March that I encourage you to take part in. Let's go to the next slide. I'm sorry. Yes, ma'am.
Okay, thanks.
Next slide. Okay. MHS Genesis portal, right? Hopefully you're all using this portal. It's another great way to talk to your provider, right? Especially during this time of, hey, wait a minute, I have this feeling, I'm not sure if I got the flu, I don't know what's wrong with me, is to use the portal. It's a great communication method. It's much better than we had with Relay Health, right? And it continues to improve. Every year they're doing updates to it. And I think right now your password's down to, I think, a 4-character password, which is pretty amazing. I mean, it's better than it's better than the library, for crying out loud. So this is one of those things that just please take advantage of, because we are one of 8 facilities in the entire Department of Defense that has this capacity. right? So take advantage of it and enjoy your time here at JBLM. Next slide. Which, ma'am, are you talking about the Genesis site portal? I believe anyone who signs up as an enrolled beneficiary has access to the portal.
And their doctors can talk to them even if my doctor is a civilian off the
If your doctor is not, if you're a civilian prime, no, ma'am. If you're MTF prime, yes, ma'am.
I don't know what MTM is.
That means you're enrolled to me. I have about 108,000 enrolled to me, and there's about 2,000 to 3,000 that are enrolled to providers in the network. So all those 108,000 can use the portal to talk to their provider. It's pretty powerful, and they're pretty, you know, they're pretty good in terms of response depending on what provider they have, right? How busy, you know, this and that. But I tell you right now, I hit on mine, and I usually hear by the end of the day or first thing in the morning the next day. It's pretty good. Any other questions on that portal? So we can go into that too. Okay. Let's go to the next slide. And we'll talk a little bit about COVID-19, right? Basically, we want to put out the preventive measures and mitigation strategies, right? Because a lot of this is the unknowns, or what do I do? And it really kind of gets down to hand washing, right? Making sure that if you're sick, you stay home, and some other elements that we're working on with the public to trying to make sure that they're squared away on it. We've talked about public health, the Department of Public Health involvement in here, and they've been very good about sharing their information with us and where we go to seek kind of issues as they come up. So we've got some hotlines that we're talking about, and we've got the nurse advice line on here to call for folks who have questions on these particular issues, right? We've had a lot of folks that presented at other places in the network for what they said suspected of COVID, what have you. They were all negative, right? So right now, those folks are all screened clear, but they're in the state of Washington, and I want to get this right, Paul. I got Dr. Festel in here. 27 cases, 27 positive confirmed cases in the state of Washington in full transparency, right? All those are severe cases, I believe. Those are all hospitalized. 80% to looks like about 87% now of cases are mild, and those are expected to be treated at home. If anyone has any concerns on that or heard any concerns on that, make sure you tell folks if they feel they have any kind of issues related to COVID or a bad flu that they may or may not have had contracted, to contact their provider first. Do not just present at the facility. And that's the same information that's coming out from the Department of Health as well, and the CDC recommendations. What are your questions? Perfect. Okay. All right. Let's talk again about the overpass for Madigan. All right. Thank you. That's it. That's it.